If someone is undergoing radiation therapy and chemotherapy, there are few lifestyle modification tips which help these women reduce the side effects of radiation and chemotherapy. The first advice which is given to these women is to remain physically active, which means they must walk and do a bit of exercise so that the blood circulation in their legs, etc., is maintained. Because cervical cancer is a malignancy of lower part of the abdomen, which has a tendency to produce a condition called as deep vein thrombosis. To avoid this complication, a woman must remain active. The second advice, which probably helps these women who undergo radiation therapy, is to keep themselves well hydrated. When the radiation therapy is done with a good hydration, then the side effects do come down. The third advice, which is very important for any women who's undergoing radiation and chemotherapy to the pelvis, is to have food which is light and easily digestible. Avoid food which is fried or difficult to digest. These are very few basic tips which help women undergo radiation therapy and chemotherapy smoothly with least amount of side effects. Majority patients who are affected by cervical cancer have already completed their family. So the issue of fertility preservation does not arise much. However, if there is a young woman where cervical cancer occurs and the fertility has to be preserved, then in case radiation therapy is being planned, then one has to do the fertility preservation procedure before starting radiation therapy, because radiation therapy does have an impact on fertility, which means a woman cannot bear babies once radiation therapy is done to the pelvis. This fertility preservation procedure includes repositioning of the ovaries to an area outside the radiation field so that the fertility can be spared for a woman who is planned for radiation therapy. Cervical cancer is the second most common cancer among Indian women, the first one being breast cancer. Fortunately, there is a vaccine available for prevention of cervical cancer, as well as when it occurs, then the cure rates are very high. When the cervical cancer is diagnosed in stage 1, then the cure rates are approximately 90 to 95%. In stage 2, with concurrent chemo and radiation therapy, the cure rates are again 85 to 90%. Even in stage 3, the cure rates are in the range of 75 to 80%.